The MSPH, as David has said, the second year you get the tuition scholarship and you do a field placement. So you do 9 months of coursework, 4 terms, and then in the second year you would do a practicum. And most of our students do a practicum overseas, and that is done at least 4 months, but many of our students do longer, and we never see them again. They go off and they go somewhere to some parts and maybe work with that organization when they graduate. We do have, at the end of the 1 year, a comprehensive exam, which may seem like not a great thing, but it actually is a great thing. It's a way for you to take all these disparate classes that you've taken and be able to study and learn how to synthesize them before we send you out into the world to be able to do a practicum. You know what you know. And the practicum is a full-time, that you spend full-time for at least 4 months. And then you do a written project, a capstone project at the end. So I mentioned there are 3 programs. The 2 Ellie and I work with are the MSPH, I'm in disease epidemiology and control, and she's with the social behavioral interventions, but we have the same prerequisites, and the prerequisites, we're really happy to be here in the fall because one of them is in the spring, and that's the global health principles and practices, the public health biostatistics and fundamentals of EPI. Have any of you taken the fundamentals of EPI? Some of you have? Yeah, okay, all right. And the biostatistics, but knowing now that we require the global health principles will help you plan a little bit for your spring term if you're interested in our department. So what are the differences in the program? Well, as I mentioned, we're focused on applications and really low-cost interventions that can help prevent or mitigate or treat disease. And these are things that are worked in partnership with local populations. And really, we're focused on innovation. There are faculty that are looking at various ways to do different interventions, and students get involved in those projects. Traditionally, we've been very infectious disease focused, but we really are having more chronic disease focus that students are interested in. I would say we are a practice-based degree, but many of our students go on and do research and go on and get a PhD because with implementation science and evaluation science, the skills that you will learn in the MSPH will serve you well whether you go on to research or you go on to a practice degree. If you're working with a program, they have data they want you to work with and be able to evaluate themselves. They need the same skills that you would need in research. The MSPH graduates go on to do many different topics, and they often work for governments, they work for non-governmental organizations, and some of the same organizations have been mentioned before. But the GDEC, I would say, is a quantitatively focused program. So the difference between our 2 programs, and I'll let Ellie talk about hers, GDEC is going to have, you have to like math. We're going to be focused on quantitative analysis. Ellie, you want to say a few words about SBS?
Hello, my name is Ellie Leoncini. It's a pleasure to be with you today. So I coordinate the master's program in social and behavioral interventions in international health. So our goal is to borrow from the social sciences and to design the best possible, feasible, acceptable, sustainable public health programs in underserved populations. We're interested very much in community-based interventions. Of course, design, implementation, and evaluation of those. I'd say a characteristic feature of the program is the marrying of quantitative and qualitative methods that we use either for programmatic application or for research. So then when you graduate from this program, what you can do, you can be a consultant, provide technical assistance to many programs out there that need some aspect of their program improved or designed from scratch. Usually they have to do with the social cultural context that surrounds the program, and then develop, evaluate, and implement the program itself. And okay, well, we've said that a few times now. Our department, the whole department is on underserved populations, has the focus on underserved populations. So here is a few organizations, like the other programs, we're showing where our graduates work, anywhere from the UN system to foundations to consulting firms. So here is some example, PAHO, PATH, Population Services International, UNICEF or Gavi, USAID of course, WHO, different health departments, even the Baltimore City Health Department, believe it or not, even though we're international health graduates, they can get jobs there. And a variety of other, of course, for many, this is a stepping stone for even doctoral level studies. And we're a research school and program, so of course, we get people with doctoral thoughts. So about 1/3, I'd say, go on to doctoral programs. And then here are our contacts. Karen, right there. Yvonne is your coordinator who couldn't come here today. My contact, and then Christina, who have we here?
I'm at the end.
All right. Shall we fill in for Antonio? Or?
Yeah, running late. He's running.
What shall we do? Shall we?
Yeah. Do you want to talk about it? So
Yeah,
you know more about the program than we do.
Christina.
So Antonio Trujillo, he's the director of the BA MHS program, and he is running late. So I'm just going to tell a little bit about the MHS. The MHS is an academic degree, is a 9-month degree, and this is especially in health economics, and it seeks to understand health systems and develop means to increase access to care and promote equitable allocation of resources in underserved populations. And so the very specific skills are learned, which is applied economics, analyzing large data sets, and cost-effective analysis. Oh,
Antonio.
he can say this much better than we
Just
can.
the first slide.
Oh my God. Better than planned.
Yes.
Hi, how are you? Hi everyone. I'm sorry I'm late, but today we have a new dean, and I really admire her, so I really wanted to stay until she's done. So I don't know how far Christina went, but I'm the director of the Master in Health Economics. So the Master in Health Economics is a very applied program where we try to use tools from economics and apply to public health. So it will not be a theoretical program in economics, but it will emphasize the application of economic tools, economic thinking into public health.
Maybe move the microphone.
Yeah, move the microphone closer.
Sorry about that. Now it's better?
Next is coming.
So as I was saying, it's a very applied program where we're going to use economics tools to solve public health problems. So you're going to have applied economics. You're going to use the use of large data set, make sense out of this data set, tell stories, and solve problems. And you're going to end up after this program with a set of tools that will make you very marketable or will allow you to go to future academic goals. So what is the program? It's a 9-month program. It's skill-based. So a 9-month program, we're going to give you a set of skills. So it's 4 term full-time. You're going to have a comprehensive exam, and you're going to have to write a scholarly paper, where you're going to be matched with, paired with an advisor in the school. And one of the roles of myself as the director or your advisor is to help you to navigate the School of Public Health. The School of Public Health, it's huge. It's a wonderful environment. It's an incredible academic environment. And our role is to help you to match with different faculties so that you can work in your applied paper. So as I said before, you're going to complete in 9 months. This is what I call a transitional degree. So usually our candidates are students who write like you guys, who are interested in getting the degree because they are going to med school, getting the degree because they're going to apply to a PhD program. So usually in PhD program, in the School of Public Health or sociology, anthropology, social science, A lot of students are required to have a master's degree, and usually they take not 2 years. With this program, you're going to take 1 year, and you're ready to apply for a PhD. So a lot of our students go to Hopkins, PhD in health economics, in health systems, or in PopFam, in population, or they go to very good universities like Michigan, Washington, Wisconsin, North Carolina, Chapter. So regarding the curriculum, and that's pretty much the last thing that I wanted to tell you, we ask you to take a few classes here as a requirement, and the classes are here. I used to teach one of these classes, which is microeconomics. So essentially what you're going to show me is that you can take the economics tool that we teach you at the graduate level, and you can survive. So in terms of, before going over that, I just wanted to tell you a little bit about the academics of the course, because it's a 9-month program, the structure of the program. So in this program, you're going to be taking classes that are from the School of Public Health that serve our program. So you're going to be taking epidemiology, you're going to be taking international health, you're going to be taking public finance. Those are classes that expose you to the field of public health and make you different from an econ department. Okay? Then you're going to be taking classes from the biostatistics department. This will give you the solid foundation to conduct research, applied research, get a large data set, and as I said before, make a story about the data set. And then you're going to be taking classes in economics. So you're going to be taking 3 solid classes in health economics, 1, 2, and 3. So you're going to have skills to understand and apply health economics to problems in public health. You're going to take classes in cost-effective analysis. A lot of economic work is related to, do we get the value out of the resources that we invest in health? So these cost-effective analysis 1, 2, and 3 are also served for that. So in Health Econ 1 and cost-effective 1, we take students from the whole school. But in 2 and 3, we go more advanced. So those are classes more tailored to the students that are taking our class. And the last sequence that we have is econometrics. So econometrics, it's use of the statistics that you taught before and make sense out of that, how to present the data, how to tell the story out of the data. So where our students go to work, so if the students do not go to academia, which I love, I want my students to keep going into academic and say in 5 years, I went to this wonderful program. Some of them decide to go to a job before deciding to continue in graduate school. So we have places students in different agencies like World Bank, WHO, World Health Organization, UNICEF, big health agency. Some of our students may go to non-government agencies in Washington or abroad. Some of our students go to consulting firm, healthcare industry, hospital industry. We have one placement in Global McKinsey, which is in Washington, a very good consultancy firm. And some of our students work in our centers. So usually what we have is 1 or 2 of our students go to the center, International Vaccine Access Center. So they have the opportunity to work in public health, to travel around, to get a really good flavor of what is public health, and then a year later, 2 years later, they applied again to the PhD program. So essentially, we have a good history of placement after you graduate. And just to conclude, when someone called me and say, if I hire this student, do you know that this student can do a cost-effective analysis? I would say, yes. If I hire this student, do you know that I can give a data set and he or she can write a report and tell a story out of this report? I say, yes. So basically, to conclude, this is a program where you're going to get very solid education, skill-based oriented education, and then we prepare to get a job or to continue your academic career. So I think this is this last slide. I'm a professor at the School of Public Health, associate professor. If you have any question, if you have any interest, if you really wanted to know more about the program or know more about what I do, so maybe you can connect of what I do and how you can see that, how this is important or not. Feel free to email me or ask me for an appointment, a meeting, and I will be happy to tell you more about the program. So I think I took my 5 minutes of thing. Thank you so much for coming, and again, if you have any question, don't hesitate to contact me, and I hope to see some of you next year in our program. So, thank you.
That's okay. Should they, mental health is next, yeah.
So now it's mental health. Are we having questions at the end?
At the end, and we have a table to sit at.
Oh,
So they come and talk to you.
All right, everyone, I'm going to finish this on up. I am not Dr. Parisi. She's actually out on maternity leave. My name is Jennifer Hansen, call me Jenny. I actually am a BA MHS student. I graduated from the mental health department in May from Hopkins in 2016. So I have kind of the insider scoop if you guys have any of those kinds of questions. But because I did go through the mental health program, I'm going to talk a little bit about that. So we are the first and only department level unit in a school of public health. So there are other institutions that have like a research track or a center that focuses on mental health, but we are the only like full department, which we're very proud of. We're pretty small with 22 full-time faculty members, but we have a lot of kind of jointly appointed and part-time faculty spread throughout both Hopkins and kind of community members that hold joint appointments. Let's see what I said. If you are interested in learning more about kind of what we look at in the mental health department, we have a Wednesday seminar series every week from 12:15 to 1:30 in the Hampton House in the basement. If you've never been to the Bloomberg campus, I understand that getting there could be kind of a challenge, but talk to me afterwards and I'll tell you how to get there. It's actually pretty easy. So our mission is really three-pronged. The first is in understanding mental health and trying to understand more about the different conditions that people face. The second is developing methodologies, whether that development process is looking at how we implement them or how we evaluate them. The entire methodology process is another one of our focuses. And then lastly, really promoting mental health in the population through advocacy and awareness. And how do we do this? There are many different data collection methods, and our program really focuses on two of them: population-based surveys. If you haven't already learned, but the ECA was kind of the epidemiological catchment area. I just know it as the ECA. That was kind of spearheaded from Hopkins by one of our faculty members, and really has informed a lot of what we know about mental health prevalence issues. And so that is kind of one avenue that we take in our data collection methods, and then also in intervention trials and trying to see what methods work and how we can optimize those and implement them at larger scale. We have a lot of different research areas. While we're kind of a small department, we have lots and lots of interests and faculty members that really are leaders in each of these fields. So in psychiatric epidemiology, it's exactly what it sounds like. And then international mental health, that picture on the far right, we've got Dr. Judy Bass. That was one of the times she went. I think this is in South Africa, but she kind of develops and implements different interventions and really focuses on the training of locals, because that's how they are sustained long term. We also have school and community-based interventions. I know that you all scroll through Facebook to kind of procrastinate, and last year you might have seen Baltimore students practicing yoga instead of detention and kind of practicing mindfulness. That was actually from one of the faculty members in our department, and so that's kind of an example of the school and community-based interventions, trying to incorporate components of mental health early on in people's lives. And then youth violence prevention programs. Some of you may have taken a class with Dr. Phil Leaf. He's a very, very busy man, but he really heads up that research center. We also have a research group that focuses on drug and alcohol dependence epidemiology, and looking at the epidemiology of like many different substances across the lifespan, as well as cognitive health and aging. So when people think of mental health, sometimes they're not really considering the later years of life, but we've got a lot of research both in the kind of more natural sciences and the really brain and neuronal levels of what's going on, as well as interventions to try and mitigate those cognitive deficits in later life. And then quantitative methods, those are for the math people. And then psychiatric and behavioral genetics, which is headed up by Dr. Peter Zandi. He's another really, really busy guy. Teaches a great class that in your senior year, I would definitely encourage you to take in the 4th term, really kind of explaining how we can look at the epidemiology of genes that are involved in psychiatric conditions. So kind of a lot of Venn diagrams coming together and focusing on a very specific area that surprisingly has kind of a lot to it, and he explains it very well. The actual degree programs that we have are, for you guys, the BA MHS, and if you don't apply during the summer between your junior and senior year, and then halfway through your senior year realize the error of your ways and want to apply, you can still apply and just be like an MHS student, but definitely apply for the BA MHS. You transfer up to 16 credits. If you plan your classes right, you can take a very light course load throughout your time as a student during your master's year. That was one of the things that I did to allow yourself to focus more maybe on your research project, because we do require students to have a final thesis project of some kind. We also offer a PhD program. We have a lot of students that will apply for that following their master's, or kind of leave and work and then come back to apply. And it's your basic PhD program. I'm going to kind of keep on going. If you are interested in getting a taste of what the mental health department offers, these are some of our kind of core courses. So if you've ever taken a class in the psychology department, like abnormal psychology, we have a class similar to that, but that really looks at all of those mental illness conditions through a public health lens. In the 2nd term, we have the epidemiology of substance abuse, kind of a really broad overview of that research area, and gaps and opportunities in public health is a nice kind of mix of policy level issues and how kind of socioeconomic factors influence how people have access to mental health care, and where we can intervene to improve. 3rd term, I've heard great things about mental health in the law. It's kind of an extension of the gaps and opportunities class. And then really one of our core courses is prevention and control of mental disorders. If you could take that during your 4th term of your senior year, I would highly recommend it. It's a great class, and then also to not have to take it during your master's year is pretty clutch. And it is exactly what it sounds like, but there are a lot of layers to prevention. When we talk about prevention in public health, it's like prevention, that's the gold standard, but how you go about preventing in mental health requires some planning, and there are different layers and different kinds of prevention that you can do, and so that class really dives into that. That's all for me, but I definitely welcome your questions. I'm kind of back in the corner, but thank you guys all for your attention.
So we're basically just going to break out by department now, and you can look around and see where each department is located. And everyone will hang fit and be available to answer your individual questions. Thanks.
Thank you.